Hello and good day. This is Linda, and this is day 3 of Focus and Calm for Kids, 10 Holistic Essentials. And today, what we're going to talk about is taking care of other conditions that could mimic or exacerbate ADHD or autism. Why do I say this? When I was doing some reading, extensive reading I did looking at ADHD online, I found a lot of different places where they said, well, check this first because it could be this, or check this first because it could be this. Most of them are things that you would deal with in holistic ways. And they can produce symptoms that look a lot like ADHD. And if you take care of them, then you've kind of won your battle. And similarly, there are conditions that the symptoms can be confused with autism. So I'll just start with ADHD and then talk about autism, just to keep it really clear. So some of the things that can mimic ADHD or make the symptoms worse are things like allergies and sensitivities. You might know this if you have kids, and there are food dyes, there's all sorts of things, food, additives, chemicals, etc. And toxicities to heavy metals, chemicals, toxicities that they have in their body. And they can also have pathogens, parasitic overloads or colonies. It's kind of gross, but they do happen a lot. And fungus, bacterial pathogens, viral pathogens, mold. There can be all sorts of things that can put that little system really out of whack, and big systems too, like adults. Light deficiency, some of these things are a bit surprising. Yeast-related complex, wow. Systemic yeast infection is way more common than we would think. And I have this going on, I would never have known, except when I was detoxing and there were gout crystals coming out of my feet. And it's like, oh, that's a byproduct of systemic yeast infection. I'm like, whoa, okay. So this is very common, apparently. Hypoglycemia can confuse the picture. Hypo or hyperthyroidism, low or high functioning of over or under functioning of the thyroid. Vertebral subluxation, so even having a spinal misalignment can throw things out of whack enough to mimic symptoms of ADHD. These things are worth checking. But anyway, I check all these things when I do an intuitive whole body brain health analysis. So it's not like you have to go running around and checking everything. It's wise just to go through, check it all intuitively, because it's easy. It's easy for me to do that. And then be really selective about what action you take. Dehydration, who knew? Dyslexia, and dyslexia is often, well, shall we say that symptoms of ADHD would probably be more a byproduct of dyslexia, right? The difficulty focusing, difficulty reading, than the other way around. Subconscious beliefs and energies. Okay, any trapped emotional energies or any traumas, chronic traumas or old traumas or acute traumas, day-to-day traumas, like for a kid who's having challenges in school or is being labeled with behavioral challenges or has outbursts or temper tantrums, there's a lot of trauma. Just in the way that they're interacting with the world creates trauma for them. And if things aren't peaceful at home or if they feel out of control of their body, that's traumatic. So there can be a lot of traumas that are stored in these bodies. And there can be underlying emotional patterns that can mimic symptoms of ADHD. And also environmental conditions, physical, emotional, or electromagnetic. What are some other ones? Sorry, I don't have it right here. But anyway, the environment and cleaning products, chemical things, and mold. You might be aware of some of these, but it's worth checking for all of them because it's so easy and so fast. And then you can take care of them before you start doing anything that's more severe, i.e. putting them on any kind of medication. In my opinion, that would be my last resort. With autism, when I was looking up this, some conditions can be confused with symptoms of autism, and really these all need to be checked out before a diagnosis is made. And if your doctor has not checked these out, you need to really start doing some questioning. So they can also co-occur. So they either can be confused with symptoms of autism or can co-occur, and that's developmental disorders, especially language disorders. General intellectual disability can be confused with autism. It's not something you want, but it can be what's going on. Childhood schizophrenia can be confused or can co-occur. Selective mutism, a child who only talks or is choosing to not speak. Hard to tell the difference at a young age. OCD can co-occur or can be confused. If somebody is anxious, highly anxious and triggered easily, right, some of those things. Reactive attachment disorder, and but this is usually only after history of severe neglect, so it's not probably all that common for you. Avoidant personality disorder, social anxiety, this can be confused with symptoms of autism or can co-occur. Vision problems, hearing problems, sensory processing disorder, this is a big one that can co-occur with autism, but can also be confused with symptoms of autism. So make sure that you are specifically checking for this, and it would be handled in different ways, very specific ways. Binaural listening is one thing that really helps with SPD. You can ask me more about that if you're interested. I know someone who does that, offers that service, and it's pretty amazing what you can do with that. So there are others, but make sure that if you're getting a diagnosis, that your doctor checks all of these things, that you don't wind up with a diagnosis that isn't accurate and hasn't taken into account all these other possibilities. With ADHD, I would say the same thing, except that your doctor will not screen for all these other things. That's not something that they do. So you're not going to get that kind of a service, unfortunately. So I'm sure you've heard, if you've been reading on like ADHD, like CADAC is a very medically oriented ADHD site, CADDAC. They talk about comorbidities, and all that means is symptoms or conditions that co-occur with whatever thing that you're talking about. So with ADHD, comorbidities like anxiety and depression and oppositional defiant disorder and things like that are very common. And there's others too. Dyslexia is very common. So it's really important that you know exactly what's going on, and if you can deal with whatever it is in a different way. And the whole point of this is you can deal with this stuff in a holistic way. You can deal with it and take care of it. Like, these things can be taken care of. And then you're not, you're not giving your kids stimulants when actually they have a thyroid problem or something like that. I mean, it's just crazy when you think of the things that we give drugs for that have nothing to do with what the actual problem is. So many things get mislabeled and misdiagnosed. It's really important. I think it's really important that you check thoroughly and make sure that you are not getting a diagnosis for something that is not that. So those are some of the things. So take care of them in holistic ways. So if you had a spinal misalignment, you would visit a chiro and get that taken care of. I had a scoliosis curve, quite 16% or something like that. And I had a year in treatment when I was a university student. Made a world of difference. Textbook straight, except for a couple bones that are wedged. So these things can be taken care of. Thyroid problems, like, there are lots of ways to take care of these things if you know what they are. So that's all I'm saying, is that's a really important thing to check out, and then take care of it before you go jumping into labels and diagnoses and medications. Please know what you're dealing with. And that's mostly what I have to say about that today. And please check it out. And I'm available here. I am happy to do this for you. And just contact me. It doesn't take long. It's very easy. It's non-invasive and it's painless. And then you kind of have an idea what you're dealing with. So contact me if you're interested. and have a great day. And I'll talk to you tomorrow about something else. Okay, bye for now. And bye again.